Arthritis treatment. The word arthritis is made up of two words, arthro meaning joint and itis meaning inflammation. So arthritis denotes inflammation to the joints. Though the word arthritis only refers to inflammation of the joints, we commonly use it to denote two types of problems related to the joint. One is inflammatory arthritis and the other one is degenerative, which is actually to be called as arthrosis, but very commonly it is also called as arthritis. The inflammatory arthritis is a whole range of different conditions that manifest by way of inflammation in the different joints of the body. There are several conditions. Most popular one is rheumatoid arthritis. There are other varieties of inflammatory arthritis like reactive arthritis, you've got infective arthritis, gouty arthritis. So there are several such varieties of causes that result in inflammation in the joint, and collectively they are known as inflammatory arthritis. Inflammatory arthritis is treated by administration of internal medicines. There are several medicines that are non-steroidal anti-inflammatory drugs in modern medicine that are helpful in managing the acute conditions. But if it's a chronic arthritis, as in the case of rheumatoid arthritis, very often drugs which are called disease-modifying drugs are used. They are effective in controlling the disease process, but very often are also cause of several side effects. Ayurvedic treatment is a very holistic approach comprising of Ayurvedic medicines, Ayurvedic therapies, and they are done regularly as a process, and they are able to give the same sort of results that modern medicine is able to give in terms of inflammatory arthritis. The best aspect related to the Ayurvedic treatment is the safety associated with that. Ayurvedic treatment for inflammatory arthritis is not only effective, it is extremely safe for long-term use. So that is a distinct advantage that Ayurvedic approach bestows on the patients of chronic inflammatory arthritis. If you look at the degenerative arthritis patients, there is only a conservative management in terms of exercises to strengthen the muscles that are associated with the joints. If there is also weakness of the bones associated with the joints, vitamin D supplementation, calcium supplementation, and supplementation of substances that are deficient in the body is the only form of treatment that is available in conventional medicine. Ayurveda, on the other hand, has a very comprehensive sort of an anti-degenerative program that is helpful in preserving the function of the joints and even reversing the degenerative conditions in certain patients whose joints are not damaged beyond a certain extent. In our experience of over 85 years at AVN Arogya, we have found that people who have been continuously taking the Ayurvedic treatment for degenerative arthritis are able to function very, very much better than when they were initially into the course. Very often these patients would otherwise be referred to surgery. The very word surgery puts a sort of a fear in the mind of the patient because they are going to replace the entire joint. Joint replacement therapy is widely used to take care of patients who have got a very serious joint condition. However, the life of the joint, the replaced joint, also does not exceed 10 to 15 years. That is another cause of concern in most of the patients, as the degenerative arthritis is beginning to set in even at an early age in patients of late. It is in this context that Ayurvedic treatment becomes very, very relevant to patients who are suffering from degenerative osteoarthritis. At AVN Arogya, we offer the whole range of Ayurvedic medicines and therapies ideally suited to give long-term relief to patients suffering from chronic degenerative osteoarthritis. We have a hospital facility to take care of patients who are extremely affected by the disease but who are not yet fit for surgery or do not want to undergo surgery because of their age or even because of certain other health conditions which prevent them from undergoing surgery. In most of the cases, we are even able to avoid the need for replacement surgery. With our treatment comprising of the medicines and therapies, AVN Arogya is able to improve the quality of life of patients suffering from even the very worst conditions in degenerative osteoarthritis. AVN Arogya Ayurvedic Hospital, 175 Villacheri Main Road, Madurai 625004, Tamil Nadu, India. Call +91 9025 700 400. URL www.avnarogya.in. Centers in Chennai, Bangalore, Mumbai, Cochin, Madurai, and Malaysia.